Is it unfair for the government to clamp down on sickness benefits? 0207 862 2222 is the number that you need to let me know your thoughts. Ministers have unveiled a plan to slash the number of people off work due to disabilities and long-term health problems. And they believe that the rise in flexible and home working means that more people should be able to get back into the workforce. And they're hopeful it will save billions of pounds when it comes to welfare budget. But it's not gone down well with disability campaigners who say the plans would they would leave vulnerable people at risk. So what do you think? Let me know. 0207 862 2222 is the number that you need. Lynn, the government's making no secret that they're trying to save the money that they're spending on benefits payments. They're also made no secret that the criteria for judging whether you're fit to work or not were put in place 10 years ago, and they would like to revisit those as well. Mm-hmm. And they're making it clear that this is, they want to help people get back to work, even if it means that they can work from home.
Yeah, I think this is a good thing. I used to be an employment advisor and I used to work with those trying to get back into work after long-term sickness on the work programme. And I think that the media has done this a disservice by saying forcibly into work or, pushing people back into work when they're unable to work, where in actual fact, the government has actually said that they would spend 58 million in trying to assist people back into work. And as we know, many people can work from home now. So it's about the assessment. The assessment is now going to change with those with mobility issues that, wouldn't have been able to get on the train as easily or get to the office. They can now look at jobs that are tailored to them from the comfort of their own home. And that must be a good thing, because we also know that even the Harvard Business School had a survey that said that people that actually work, it releases positive emotion when they have those significant duties at work and they feel fulfilled. So it's a good thing to go to work.
What do you make of Mel Stride's proposal? He's their Secretary of State for Work and Pensions.
Well, when they tried to balance the books on the back of disabled people under George Osborne, we ended up with the spectre of people who were half paralysed being found fit for work. We had the sight of people when, shortly after being found fit for work, many of them died. And actually, for a long period...
How many died?
I don't have the exact number off the top of my head.
But you're throwing these...
I just remember I covered these... I wrote about specific cases.
When you're talking about death, you should have the statistics, no?
Absolutely preposterous. Several people died, which I wrote about those cases when they happened, before 2015 under George Osborne. If you're doubting whether people died after being found fit for work, I can show you straight after the programme a whole list of them if you like. The problem with this is no one is saying that work wouldn't be a benefit to some people at the moment who find it impossible to work. The problem is that mental health campaigners are condemning these proposals, people who actually work with people with mental health problems, because what you need to do is rely on carrot rather than stick. And the focus here is coercive. And the problem is, if you end up with an approach which is basically threatening people with taking away their benefits, they stop seeing job centres as places they want to work with. They end up seeing them as hostile environments. And you end up making people with underlying anxiety, which is a big problem. A lot of these people have huge issues with anxiety, feel even more stressed, and you exacerbate their mental health problems. So the problem is, if you rely on this approach, which is we're going to get to work or else, you end up with often very mentally vulnerable people. Their conditions actually get worse. It becomes harder to get them into work. That's why the focus should be on support. And the problem we have you've just come up with 55 million or so, which is peanuts. The problem we have in this country is mental health services are catastrophically under-resourced. So the problem is you don't get the help that you need. We need billions of pounds being put into mental health services in order to make them fit for purpose. The problem at the moment is you have lots of people with very acute mental health problems. They don't have the support they need, and it is not realistic to think using coercive or threatening means with people with underlying mental health problems is going to get them into work.
Do you not think many have felt forgotten, though? Because when I used to speak to many people who were on ESA, Employment Support Allowance, at the time, many of them actually said we're really appreciative of finding out about what is available to us, because when we have applied for jobs, we feel that we're not wanted because we either have a disability or we are long-term sick. This now allows it empowers those to feel, well, maybe I can start off with 1 day a week or 2 days a week, then potentially full-time. I think this is such a positive thing. And to say that, they're being coerced, no, people with end of life, terminally ill, and those who have major illnesses will not be considered.
How gracious!
They're not going to be forced.
How gracious is the government? They're not forcing terminally ill people to work. Yeah, wow. Let's give them a cookie.
I'm saying there's multiple people that will not. Be forced.
People on their deathbeds won't be forced into work. Just quickly,
mental health
the problem on that is what you said. No one's saying we shouldn't offer more support. That's a good thing.
It is support.
That is not the focus of the government's plan.
That's what they've said. They've said support.
The focus is not. It's on stick. And that is counterproductive. That's the problem.
I'm going to pause you there. Let's bring in someone with real concerns about these plans. Rachel Charlton-Dailey is a disability campaigner, and she joins us now. Rachel, good afternoon. Thanks so much for giving us your time.
Hi, thanks for inviting us on. My concern is not that it's going to be this great thing that we're inviting disabled people to work. It is that they're not focusing on why disabled people can't work. There's a lot of disabled people who are qualifying for the range where you can't work, where you're not fit for work, who are still then just left not with any resources. Who are not being considered for this, who are still then left with lots of resources. And to go back on how many people have died, the reason there isn't a figure on how many people have died is because the government won't release this figure.
Rachel, let's go back to what the government is proposing. And some people have picked on this detail that, for example, the way we assess whether people are fit to work in order to decide what benefits they're entitled to dates back to about 10 years ago. Would you agree with the government that we need to review how people are assessed?
Okay, yeah, we do need to review how it's assessed, but not in the way that the government are proposing. We need to make it more so that more illnesses are considered, that the nuances of illnesses are considered, so that we have more done for people who have fluctuating conditions. Because at the moment, when you're assessed for these things, they don't take into account that some days are really good and you could work on those days, and then that some days, like for instance, some days I can't get out of bed. So I've done this today, which the government would probably say I was fit for work for, but then in about 2 hours' time, I'm going to be back in bed because I'm going to be exhausted. Are the government saying that I can work 2 hours a day, 2 hours a week, Rachel, and that's going to be enough for us to live on?
No, I understand where you're coming from, but Rachel, what about those 10 years ago? We didn't see this ability to work from home. So multiple people that used to come to me would say, I have anxiety to leave my house, or I'd have mobility issues. If a job can now facilitate where they are at home, where they're in the comfort of their own home, and they start off with 2 days a week, shouldn't that now be assessed because of the ability to work from home?
Okay, yeah, but not all jobs can be worked from home, and you've got to consider that not everybody is computer literate. 1 in 3 disabled people don't have internet access. Something like, I can't remember the exact figure, 40% of disabled people aren't computer literate. You're expecting people who don't know how to do these sort of jobs, and people who potentially can't even afford a computer or internet access, to suddenly take up these jobs because they're available.
But many jobs will support them.
When these are things that disabled people have said we should be able to do for years, and it's literally only because the majority of the population had to work from home that we were able to work from home. We've been asking to work from home for decades, and now it's suddenly because the majority of the population can work from home that we are able to work from home.
OK, Rachel, stay with us. Let's find out what people are saying at home. Sarah in Liverpool. Good afternoon, Sarah. What do you make of the government's new plans?
Good afternoon, Alexis and panel. To be perfectly honest, I think this is another example of the government kicking people who are sick and disabled when they're down. I've seen this for the last 13 years since this shower have been in, and I speak from first-hand experience of their behaviour. The way they've treated people is disgusting. Even though you send in all your letters from your consultants saying what your condition is, how it affects you. You send in your sickness, your diaries, your statement on how everything affects you. When you get in front of some two-bit assessor, and I do mean two-bit, they're not medically trained. They go, "Oh, are you sure about that?" And you go, "Yes." And can't you read that it says that I cannot do this particular task repetitively, repeatedly, as it would be to the detriment of the health and safety of myself and others? You can read that, can you? Yes. You have seen the amount of medication I take a day. You have seen what the consultants have said, have you? Yes.
Okay. Sarah,
do you believe me? No.
Yeah, and the reason we shouldn't trust, I have to say, the assessments. I mean, Lynn asked a very reasonable question when I said people in the past had been found fit for work and then died, and she asked for numbers. Very reasonable question. Happy to give you those figures. So between December 2011 and February 2014, 2,380 people died after being found fit for work. You cannot trust a government.
And it's directly related to them going into
cannot
work.
trust. They were not. No, the fact is they were not well enough to work. The point I'm making is the government's starting point isn't how can we help these people. The government's starting point. No, let me finish. The government's starting point is how can we save money? Okay. How can we lop money off the welfare budget?
Okay,
and that's the problem. It's the wrong approach.
I'm going to pause us there because we're going to take a break and come straight back to this subject. So, Sarah, thank you for your call to this. Thank you to Rachel as well, Rachel Charlton-Dailey as well. We're going to be taking more of your calls on this. So many of you want to have your say. And we're going to... Owen, is the problem that we heard it from our previous caller. Look, Liz makes a very good point that it's beneficial for many people who are able to work to do the amount of work that they're able to handle. But from our earlier caller, we got a sort of a slice of what it's like to be assessed by people who are filling in a form, who are not medical professionals, who are deciding whether or not you can qualify. So is that an area that the government should be looking at rather than what they're suggesting at the moment?
That's the problem, because what we're talking about, look, great for Liz, and this works for her, and best of luck. That's a great story to hear from. The problem is all of these cases are so wildly different, so you need very individually tailored support. And the problem is you don't often have the training there to make sure that you're giving the right assessment to the right people. I mean, this is the problem with the government's proposals. What they're doing is extending what's called conditionality. What it means is you apply more sanctions. That means stripping people's benefits if they're deemed not to comply with what you're setting out to do. And the reason that's counterproductive when you're talking about people with mental health problems is it can spur on more mental health crises and make them less likely to engage, particularly because what you want people with mental distress to do is to see job centres as helping hands. But if you end up making them feel like places which are there to threaten you with sanctions, you're less likely to engage, and then you end up drifting further from the jobs market. That's the problem. That's what the experts think.
OK, Liz, thank you. Let's take another call. Samantha in Lancashire. Samantha, good afternoon.
Hi, good afternoon, Alexis.
What are your thoughts on these government proposals?
If I'm honest, it absolutely petrifies me. I'm on disability benefits myself. I unfortunately got hurt during work and damaged my back, and some more conditions have kind of come about since then. Every day is different. One day I can be able to do things, other days I'll be bedridden. I am at risk of falls, and I do take a lot of medication that can interfere with my concentration and my thought processes. So as much as I want and would love to work, my body won't allow it.
Lynn, is what we're hearing from Samantha there, and we heard it from Rachel, our disability campaigner. It's going to be very difficult for any system, no matter how well-intentioned it can be, to assess someone like Samantha and previously Rachel. If on one day you can work, the next day you can't work, that's going to be very, very difficult to assess.
Yeah, I can't comment. Obviously, Samantha, you said following on from a back injury, it's led to other issues, and I can't comment on you directly. But when it comes to a more of issues like mental health issues, or even if you look at someone who's had a car crash and they have to go through physio, and the physiotherapist is saying, go on, try and do 2 steps, and they're saying no, and they're saying encouraging them to take 2 more steps so they can walk again. I see it more of a situation like that. So again, for example, when I did used to work in welfare to work, it wasn't about I've got a disability, you've got to go and work 5 days. It would start with, and this would be my way of doing things. Okay, we'll work through a plan. Can you attempt to walk maybe 5 steps if they've got anxiety out of your house, just 5 steps, and we'll see how we go with then. And we'll have a 3-month plan. That is supporting someone into doing things. Now, when someone says to me, I refuse point blank to do anything, that's when I can see a need for saying, well, we have to look at your benefits then because you're refusing to engage.
Samantha, what do you make of what Lynn's saying? Is the way that people are being assessed the problem?
It definitely is. The paperwork is so ambiguous. And I had to go to tribunal to actually get my benefits. And you basically sit in front of a judge, a counsellor and a disability advisor. And then they decide your future.
Samantha, if you said previously that you would like to work in the future, so you sound quite young. Correct me if I'm wrong. So if you
I'm 37.
Yeah, okay, so quite young. So what does that look like to you? I'm sure you're not writing off your life for the rest of your years. So give me an example of how you could start to see going back into work, because you said you want to.
Oh, I loved my job that I did, but I worked in healthcare. And that's where my passion is and my love. And with my conditions, there's just no way that I could go back into a career such as that with these disabilities that I now have.
Samantha, sorry, so just for example, just to show and highlight to people, what if you were to have a job, maybe an hour a day, talking to people in the healthcare profession that had accidents like you, where you could provide support, conversations? Would that seem like a job that you would like?
That would actually be a really nice idea, but there isn't a support system there to do that.
So Samantha...
Yeah, you're inventing a job that doesn't exist.
No, I'm not. No, it does exist. It does, Owen, that's your problem. You don't see any creativity when it comes to people with disabilities and illnesses going back into work.
Yeah,
and I think that's
not true.
I think that's
I said that I think
damaging.
No, I don't.
That you're creating jobs. Working is about being creative. It's about seeing what's out there.
I'm aware of that, but the problem is, as far as and Samantha can correct me, she's not been offered that job.
She said there's no support for it.
Well, that's the problem. I think the issue is we're getting slightly, I think, misunderstanding each other, perhaps. Just let me be generous about it.
OK, go on.
Because all of us agree that those who can get into work and that has a beneficial impact on them should. The issue is the government has a approach which is about conditionality and sanctions, which is counterproductive, when what you're actually rightly saying there is they should be focusing more on expanding support. That's where we should be agreeing.
They've said support. They've countless times.
Yeah, but not. When
I worked on the work programme, which was introduced by the Conservative Party, we with charities supported people. I'm not saying that there weren't some who didn't support, but most of us were very supportive of getting people back into work.
By definition, when you're cutting the benefits bill, which is their stated, literally their stated,
needs to be done,
literally their stated purpose, that is not providing the support you need, because if you're going to provide support, you'd have to be increasing spending.
Let me pause you there because I want to squeeze a couple of more calls in. Samantha, thank you. Very, very interesting call. Joanne in Lancashire. Good afternoon, Joanne. The government says it wants to, and I'm reading from their literature here, they want to be giving people more support to work from home if they can, rather than being on benefits. Is that a good idea?
I agree totally. Like Samantha, actually, I would love to go back to work. I used to teach. I really miss it. Unfortunately, no matter what support I would get, it's not physically possible. I'm on morphine. My spine's crumbling. I've got spinal stenosis and I have heart failure. There is no way I can work. I want to. I really, desperately. But the problem is, people are being penalised, genuine people, because there are too many people who are faking being ill and using, a lot of the time, they're using the excuse, I've got mental problems. Rubbish. People can work if they've got mental problems. It's can't walk, that can't use their hands. Those are the people.
That's not what medical professionals think. I mean, sorry to be blunt about it, medical professionals don't agree on that. There are many cases where people's mental health conditions are so acute that they can't work. Now, there are people with depression and anxiety who can. 1 in 4 people suffer from mental health conditions at some point. That's true. But there is a significant number of people who can't, and they need particular tailored support. And I don't think it helps by saying anyone with any mental illness, regardless, is able to work, because that's just not true.
Yeah, I didn't say anyone, and I agree with you partially on that. The problem is there are too many people using that excuse when there's actually nothing wrong with them.
But then, Joanne...
That's what I'm getting at.
Sure. And Joanne, you make your point, and you make it very clear. But something that Owen mentioned at the beginning as well, and I've been looking into before we got on air, the amount of staff that have left the NHS mental health workforce is staggering. 17,000. There is a queue of 1.8 million people waiting to see a specialist for mental health. We've seen a huge increase, as you say, in people who are suffering with mental health problems, but the NHS help is not there. Now, those people, what happens to them? Well, they say they can't work because of mental health issues. They're not being properly assessed because the NHS is understaffed. And now the government are saying, well, we need to try and get these people back into work. Do you think that perhaps the government should be also looking at how to get help to these people and perhaps help them overcome their mental disabilities so that they can go back to work?
I think a lot of the people, like your example, people in the NHS, yes, they have been under a lot of stress. I understand that totally. It should be on individual cases. And I think that people from the NHS who say, oh, it's too stressful for me, fine. They could go into a less stressful job. It doesn't automatically mean that they become... I'm not going to say disabled, but can't work and go on benefits. It doesn't mean that. Okay. It means that, yes, they can get help.
OK. Joanne, thank you. Really, all your calls have been really fascinating because they come from a point of view of having had that experience yourselves. Michelle in Manchester. Good afternoon, Michelle. What would you like to say?
Hiya. My husband has been on sick, and we had to go in to see somebody for a back-to-work meeting. And the lady at the meeting considered that he was fit for work, which he's got a lot of problems with, and he obviously wasn't. And his anxiety from that meeting just literally went absolutely through the roof because he felt he was made to feel like a disappointment, if you will. And the next day, and I really consider it was brought on from that meeting, he actually had a heart attack and died.
By the way,
just so sorry to hear that.
Michelle, by the way, I'm devastated to hear, really devastated to hear that. And this is the point I was making before, actually, a very shocking, extreme case of it, actually, which is if you put huge amounts of stress on people with severe mental health conditions, there can be disastrous consequences. In this case, a fatal case. Again, that's the problem. You have to offer people with mental health problems support. You've got to resource our mental health services, which are completely at breaking point. But unless you invest in support and emphasising support, if you focus on sanctions and conditionality, which however you spin it, that is central to the government's package, you risk cases like this.
But what would you do with somebody who just point blank refuses to engage when they're being advised, try? What would you do then?
To be honest, I think it would depend on the case. I mean, I don't know. I mean, there are people who refuse because they're adamant that they have severe conditions which need support.
It's extremely...
You have to tailor it.
Obviously, Michelle's situation is heartbreaking, and I'm sorry to hear that, but it is far too easy to be written off as depressed and apply for benefits. I could easily do it now. I could go to my doctors, they could deem me depressed, and I could apply for ESA or universal credit.
But it isn't, because as we've just heard, people who are clearly very, very ill are being found fit for work. So that's not true. We've just heard a case.
Look, I'm going to pause it there. Thank you so much, Michelle. Thank you for your bravery in picking up the phone, sharing your story with us, and our condolences from everybody here. Thank you all for your calls of this. I know that these calls are not very easy to make, so thank you for picking up the phone.